Hello guys, today we are going to study about cystic fibrosis. So how will a patient of cystic fibrosis will present to you? Let's see. So the clinical features of cystic fibrosis includes certain organs like involvement of lungs, involvement of liver, pancreas and gut. The patient will present to you. Let's see. So in infancy or early childhood, you will find the patient will come to you with recurrent history of infections, recurrent pulmonary infections. And if you look at the causative organisms of these infections, in case of infants or early childs, the organism is most commonly Staphylococcus aureus, whereas in case of adults, this recurrent infection, most common cause will be Pseudomonas. Apart from that, in cystic fibrosis, allergic bronchopulmonary aspergillosis is quite common. The patient might have chronic bronchitis and bronchiectasis. So if you look at this X-ray, in this X-ray you can see this reticulonodular patterns in this X-ray. You can see this reticulonodular pattern is seen in cystic fibrosis in chest X-ray. Apart from this, there may be association with sinusitis. So there will be some sinus opacification in the X-ray. Then there can be associated nasal polyps. There might be nail clubbing in physical examination. Cystic fibrosis may lead to pancreatic diseases like pancreatic insufficiency, which may lead to malabsorption, and then also will be associated with steatorrhea, passes of fat in the stool. So as we can see here, the fat is passed in the stool, so there will be a fat soluble vitamin deficiency. What are the fat soluble vitamins? We all know A, D, E and K. So these vitamins may be deficient in cystic fibrosis. Due to deficiency of these vitamins, it may also lead to some endocrine dysfunction. So there is an entity, disease entity, that is known as cystic fibrosis related diabetes. So it is a endocrine disease which is related with cystic fibrosis. In the liver, the patient might have biliary cirrhosis, and there might be other liver diseases associated with this condition. Also, in newborns, cystic fibrosis may cause some complications like intestinal obstructions, like meconium ileus in newborns, and in adults, rarely it may cause rectal prolapse. Apart from all this, cystic fibrosis may be associated with infertility in males. This might be associated with or due to absence of the vas deferens in males. Maybe in some cases the spermatogenesis is okay, it is unaffected. And in females, cystic fibrosis may cause subfertility associated with amenorrhea and thick cervical mucus. So what is the gold standard investigation of choice for this cystic fibrosis? The answer is pilocarpine sweat test. So this is the test being done here with this kid. You can see in his hand 2 electrodes you can identify. This test is known as pilocarpine sweat test. We'll discuss this in later slides. So now that we know about the clinical presentation of the disease, let's discuss about some important genetics. So cystic fibrosis is a autosomal recessive condition which involves the chromosome number 7. The gene is called CFTR gene, and there is a defect in the CFTR gene which causes this cystic fibrosis. So there is basically deletion of this gene on delta F508 location. So all these points are very important. And another thing that you must know is the CFTR gene, the full form is cystic fibrosis transmembrane conductance regulator gene. So this is the full form of the cystic fibrosis gene. So basically this CFTR gene it contains the code that creates a channel for chloride ions. So this CFTR channel is basically a ATP gated chloride ion channel, and its basic function is to secrete chloride in lungs and GIT mostly, and reabsorb chloride in the sweat glands. So the child basically inherits one chromosome from each of the parents, and this gene, as we have discussed, it basically creates this channel, CFTR channel, which transports the chloride out of the cell, secreted into the lumen. So what happens due to this delta F508 deletion is that the proteins that were formed by this CFTR gene starts misfolding, and due to this misfolding there is defect in the transport of the protein that is synthesized, and that's why there is protein retention in the rough endoplasmic reticulum of the epithelial cells. And thus, as the protein is stuck in the rough endoplasmic reticulum, the normal channel which was supposed to be there in the cell membrane, that is absent, and that is the main pathology behind cystic fibrosis. And this absence of protein from the cell membrane results in no chloride secretion, because the chloride cannot get out of the cell or secreted by the channel because the channel is absent. So this results in decreased chloride and water secretion from the epithelial cells. So now that the chloride ions cannot get out of the cell, they will accumulate inside the cell, right? So inside the cell, these chloride ions, they will trigger a compensatory mechanism by activating the epithelial sodium channels, or ENaC. So this sodium channel activation, what they do is to compensate the increased amount of chloride inside the cell, this ENaC channel will bring sodium ions from the outside of the cell to inside, that they can balance this chloride accumulation in the cell. So to balance this negative charge increase in the cell, they bring positive ions like sodium inside the cell. And there is a rule in biology, that is wherever sodium goes, water follows. So it will also absorb water from the lumen of the GIT and lungs, and it will absorb the water from the lumen of GIT and lungs. So the mucus that is being secreted in the GIT or the respiratory tract, that lacks that water now, because the water is going inside the cell with the sodium. So the mucus becomes thick, and also as the sodium is going inside, so there is a negative trans epithelial potential difference. So that is also there. So what is this trans epithelial potential? That means the potential difference of electrical charge between the outer environment of the cell and the inner environment of the cell, that is known as the trans epithelial potential difference. So it becomes more negative due to this. So now you can see a very thick mucus can cause these clinical features and complications that we see in the cystic fibrosis. So presence of thick mucus in the pulmonary tract will definitely cause recurrent pulmonary infections, because they will harbor more organisms, pathogenic organisms, and also they will obviously cause sinusitis. Recurrent infections and sinusitis will be associated with nasal polyps, inflammation, and other things. They can also clog the liver tract, causing biliary cirrhosis. They can also clog the pancreatic secretions. Thick pancreatic secretions will clog the pancreatic ducts and cause pancreatic insufficiency, malabsorptions, and the following other complications. And also meconium ileus or rectal prolapse, all these are due to thick mucus secretions. So now what are the additional things that we'll see in the cystic fibrosis? So there is always associated with the contraction alkalosis that is there, and sometimes it may be associated with hypokalemia. A patient having cystic fibrosis will present like a patient having loop diuretics. So why this hypokalemia occurs is basically the sodium and water is secreted in the sweat, the excess amount that we can see. So to compensate this, the potassium ions and the hydrogen ions, they are secreted into the urine. So thus the blood will have less potassium, causing hypokalemia, and also have less protons, causing alkalosis. In the pancreas, the pancreatic duct gets clogged, as we have discussed earlier, due to thick mucus, and thus it leads to, in case of newborns, it leads to increased amount of immunoreactive trypsinogen. So this is another diagnostic marker in newborns. So about the management, so we basically, investigation of choice is pilocarpine sweat test, and the value of pilocarpine sweat test is, it should be more than 60 millimole per liter to say it is high, and thus suggesting the patient might be having cystic fibrosis. And the value which is from 30 to 59 millimole per liter. It suggests moderate increase in chloride ions, and this requires more genetic testing to confirm cystic fibrosis. Values less than 30 millimole per liter is quite low, and it can rule out cystic fibrosis. So here you can see how the test is being done. Basically, this is the skin, this is the sweat. You can see the duct of the sweat gland is here. So basically you can see here where the mutated CFTR chloride channel is there. So high chloride concentration is there in the surface of the sweat gland. So in pilocarpine sweat test, we basically test for chloride concentration. So what happens is there is an electrode that is placed into the skin of the baby, and it drives the medicine pilocarpine into the skin. And then there is a filter paper that is placed in the baby's skin, and that collects the sweat on the filtered paper or the gauze. And then the sweat is analyzed for the chloride concentration. So what about the treatment of the cystic fibrosis? So basically non-pharmacological treatments are there, like chest physiotherapy that we can do. Apart from that, hypertonic saline inhalation can be done. Short-acting beta agonists like albuterol can be given. Then aerosolized Dorniz alpha can be given. Azithromycin is given as an anti-inflammatory drug in case of cystic fibrosis. And ibuprofen, that is given to slow the progression of the disease. And in case of pancreatic insufficiency, we give pancreatic lipase. So all these are basically supportive treatment. So now, to improve the chloride channel transport, we have some drugs specific for this condition, like lumacaftor or tezacaftor is given along with ivacaftor. So how these drugs basically work, let's see. So lumacaftor or tezacaftor, they basically help these CFTR proteins to come back to the cell membrane. And ivacaftor, in the other hand, it helps in these channels to stay open for longer period of time, that it can transport the chloride ions. So that's how these drugs work. So thank you guys for watching. Hope the video was helpful for you, and please subscribe for more.